Testosterone is prevalent in men and women just as estrogen is. But what is testosterone and what happens when your levels are off?
We had the chance to speak with Dr. Sharita King, attending urologist at Augusta University Health, WellStar MCG, to get the scoop on what testosterone is all about and all about how much is too much or too little. Dr. King, thank you for joining us. Appreciate it.
Thank you for having me.
Absolutely. Something we don't talk about a lot here on this show, but men's health. We had a recent interview with Dr. Jed Ballard. We talked about testosterone, the importance of it in muscle building and bone density and libido as well. And there are some natural ways to boost the testosterone too. Improving your sleep, proper training, less alcohol, maintaining a balanced diet. What if some of those natural ways don't work?
Yeah, so as men age, their testosterone starts to slowly decrease. It's sort of like when women go through menopause. Some people have dubbed it as menopause.
Yeah.
So as you age, your testicles just aren't making as much testosterone. So then you need to find a professional that can help you with maintaining that, and you can do that with testosterone replacement therapy.
Okay, also known as TRT. What are the choices that you have for TRT?
Yeah, so there's a lot more new choices out on the market right now. One of the newest ones are some pills that are out there. One of them is called Jatenzo. It's great because you don't have to do injections or put on gels every day, but you have to take it twice a day. There's also the tried and true ones that we've always done. You have the daily gels. You also have injections that you can do intramuscular. And you do those either every week or every 2 weeks, or you can get pellets that are placed every 3 to 6 months. And it just depends on your lifestyle. Like, are you really going to take something twice a day, put something on every day?
Do you have the time and the inclination of it?
Exactly. Yeah. Or would you be better at doing them at different intervals? So just consulting with a good physician or a provider and making that choice. And then also insurance can kind of play into it because the cost can be a problem.
Also a good way to think on that. What are some considerations you need to take into effect if you're considering TRT?
Yeah, so there's a couple of things. One, I can't stress enough, make sure you have a professional that is used to managing testosterone. The important thing is because we'll have to kind of gauge how you're doing with testosterone, monitoring levels, and changing them over time. With monitoring levels, you want to make sure that you're getting your labs checked. I like to do mine every 6 months. I think is very important. So that way we not only know what your testosterone level is, so we can make sure we're keeping you at a good level, not letting you get too high, and make sure that you're getting enough. But you also want to look at other things. So one of the really big markers that we should be checking is hemoglobin or hematocrit. That's looking at the red blood cells in your blood. The reason why this is important, there were some studies that showed that TRT can cause an increase in blood clots. It's not so much the TRT, it's when your hemoglobin or hematocrit goes up because your blood is thicker, basically. So you want to make sure that somebody is checking that to keep an eye on it, because there's things that we can do to try to fix that. Another thing is fertility. So you want to make sure that if you want to still be able to have children, you do not want exogenous testosterone or testosterone from the outside. So Dr. Ballard did talk about like the feedback that comes along with testosterone. So when your testosterone is going up because we're giving it to you, then your testicles go on vacation, basically. So they're like, hey, well, if I don't have to make testosterone, guess what? I'm not going to make sperm either. So then you will not be fertile.
Let's not do the sidestep.
Yeah. So just pay attention. If that's something you want, there are options for that. And then just, again, consult with a good professional. And then another thing is have realistic expectations to what testosterone could do. So you talked about it. It can help with libido. It can help with your mood. It can also help with energy. It can help with exercise tolerance. But you also have to have like a good balanced diet. You have to have good lifestyle modifications along with that to get the best out of it. So Dr. Ballard was exactly right. You want to make sure that you're optimizing your health before you get on it. Another thing that people kind of get confused about is they think if they get on testosterone, all of a sudden their erectile dysfunction will go away. It doesn't quite work like that. Yeah, that's more of a blood flow issue. This is more of like a hormonal. It does help. It does have something to do with it, like the health of the tissue, but it doesn't improve the blood flow.
And you also, again, you mentioned this before, you want to maintain it because, as with anything, too much of anything is too much.
Yes.
And not a good thing.
Absolutely, absolutely. Because if you go too high, then you can have side effects. Some of the side effects can be oily skin. Some people can have male pattern baldness. Another thing, you can have mood swings, so what people call roid rage. Another thing is you want to, with monitoring levels, you want to look at estrogen. So if you have more adipose or fat tissue, your body will tend to skew the testosterone over to estrogen. So you want to keep up with that. Estrogens are important for men just as they are in women, but you don't want them to get too high.
Any final thoughts for our viewers to take into effect?
Yeah, so I think testosterone is a great way to help with some of the ailments that some men are having, like low energy, low libido. But you just need to make sure you're with a proper professional who can really guide you through that, so that way you're doing it safely. Make sure you're getting labs, and this is a good treatment for you.
All right. Maintenance, and yeah, keep in line with that, and be sure you check with your doctor. Dr. Sarita, thank you so much.
No, thank you. Thank you.